Hello, everyone. Welcome to week 7. I'm Mrs. J, one of the curriculum developers here at AMCI, and I continue to be amazed by your progress. Coders, some of you are developing and becoming these forensic, accurate, certified, and ethical coders. That's right, the face of medical coding. All right, I'll tell you about that later, but some of your questions in Discord just lets me know that you're not just memorizing these diagnoses. You are becoming forensic. I love it. I love it. Your questions are incredible. Okay, so this week we're going to discuss pregnancy, perinatal, and congenital anomalies, but not without first me recognizing an incredible team. So, sending my love to our instructors and interns who are the baddest on the planet when it comes to medical coding. I believe it. And you know what? They're going to just continue to help you out in the chat and they're going to help you break down those guidelines the AMCI way. All right. Oh, and for you, coders, you have questions. We've got answers. And it's just one. This is the most commonly asked question. How to join Discord. All right, coders. So, anywhere on our website or YouTube channel, any video, there is a join button right there next to the subscribe button. Make sure you subscribe too. All right. So, that's how you begin. You um, click the join button, select your plan, and after you make your payment, you're going to have to link your YouTube channel. So you got to remember your email address, the email address that you use to purchase your plan, because that is how you will be connected in our Discord and they will give you the proper access to the resources. So after you join, you got to link your YouTube channel to Discord. So, what you're going to do when you bounce in or come in, at the bottom next to your name, there's going to be a cogwheel in the bottom left corner. Click it. All right. After you click it, you're going to see this menu and click Connections. After connections, you're going to see all of these icons. See that green box? You got to click that arrow because we have to get to YouTube. We're trying to link YouTube. So you click on it, and then YouTube is all the way at the end. So click on YouTube and just follow the prompts, right? So once you follow those prompts and once connected, a check mark display will appear on your profile, right? And then that's it. So there you go. Speaking of Discord, we've made some changes. So for those of you that are already in Discord, you kind of are familiar. If you're new to Discord, start at welcome. Everybody else just want to let you know the changes. So you start at start here if you're new. It's start here, then you do your welcome and then read announcements. And if you still need help linking your YouTube channel, the instructions are there. All right? So for those that are currently in Discord, we got some changes. We kind of organized it better. You've got questions. If you have a question for the Coding Chat Lounge, click there. A question to ask an instructor, click there. A question for Mrs. J. A question for Mrs. J. Click here. And when I'm talking about the lunch with Mrs. J. So if you want to get me your question ahead of time, click that. Also, assignments and notes. So your weekly assignments will be here and any additional resources will be here as well. Then you've got daily scenarios. Yeah, every day we send you something. We're going to prompt and send something just to kind of get you going. And I want you to see more. I couldn't put it all on one slide, so let's go to the next. All right. So we have organized them according to topics. So if you have a question or want to make a post on a specific topic in Discord, if it's regarding a daily scenario, post it on the day of the week. If it's Monday, it goes there. Tuesday, Wednesday, etc. Now, these are on specific topics. Typically, you won't be the main poster. You might want to respond to the Monday MCG manual question or the Forensic Friday question. They'll be sitting there. Also, if it's an ICD-10-CM subject, and let's say if you have a specific question about any of these topics, I suggest putting it here. And here's why. Because it stays here. It's going to stay here. If you put it in the general chat, then you are going to probably get lost and your question gets organized. So put your pertinent questions on the subject that it's pertinent to. So if ICD-10-CM, this week we're talking about pregnancy. If you have a question about pregnancy, put it there, right there. All right. And the same too for CPT subjects. There you go. Hopefully that helps get you a little organized. Now, the books. The books that you're going to need for today's class. You're going to need ICD-10-CM. If you intend to take the CCS, we recommend ICD-10-CM Expert for Hospitals. Number 2, this Step-by-Step 2025 by Carol Bucks. You can get any publication between 2023 and 2025. And finally, the AMCI MCG Manual 2024 and 2025 are the two that you could have, are the two options. Now, just want to ask you to let everybody know about this course. I'm telling you, this is the best kept secret. Don't let it be a secret, coders. Don't let it be. You know what? Share, share, share. The more you share, the longer this course will last. No, we do have a 16-week course, but we're thinking about some other free stuff. But if we don't see any interest in it, then what are we doing, right? So please share this with everyone. Tell everyone about this course. Now, before we get started, let me read this copyright. Oh, and by the way, I'm saying thank you in advance. CPT is copyright of 2025 AMA. All rights are reserved. Keyword concept, FTR, Chun, AMCI Feb 7, AMCI ICD-10-CM, Flip Tap, and MCG are registered trademarks of AMCI. CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials. Goals of the presentation for week 7. Number 1, chapter 15. This is ICD-10-CM chapter 15 guidelines on pregnancy complication. Number 2, chapter 16, perinatal guidelines. Number 3, chapter 17, congenital anomalies. And goal 4, we're going to give you practice scenarios to test your knowledge. Now, don't forget to follow along in your MCG manual. Go ahead, get your MCG manual, flip to chapter 15. If you don't have the MCG manual, we recommend the official coding guidelines because everything is in order. And the link is in the chat. Team, the link is on this corresponding slide if you're looking for it. So it's in the chat. Okay, coders, let's dig in and get to work on chapter 15. Welcome to Chapter 15. In this chapter, we will discuss pregnancy, childbirth, and the puerperium. But you'll come to learn that Chapter 15 is pretty much pregnancy complications. And you'll also see that it's unlike any other chapter because these codes, if applicable, have sequencing priority over all other chapters. And these codes are provider driven. So it requires you to be forensic and pay attention to the documentation. You got to pay attention to things like the, um, weeks gestation and the trimester and complications. All right. So I think that's pretty much it as an introduction to chapter 15, but I do want to tell you about some pregnancy coding guidelines or tips, or we like to call them FTRs or facts to remember. All right. So, here are the pregnancy coding guidelines or tips or facts to remember according to AMCI. Number one, most Chapter 15 codes, O codes, are used for pregnancy complications. Now you'll see mention of some Z codes. They are encounter codes and they go hand in hand with this chapter. So they are not complications, but they are pertinent to this chapter. But the O codes are used primarily for pregnancy complications. Also, like I've said before, these codes have sequencing priority over other chapters when pregnancy is the RFE, pregnancy complication. Number three, when the reason for the encounter is not pregnancy, you need to sequence the reason for the encounter first. That's your first listed code. Number four, pay attention to the week's gestation code on site. That's a gimme, right? So if the answer documents the incorrect week's gestation, you can kind of eliminate that answer. Just saying. Also, when coding deliveries, and there are multiple O code complication codes, sequence the reason for the delivery first. Now, here is a big tip when coding deliveries. The reason for the delivery often has the word delivery in the code language, and that's often your first listed code. So some people get intimidated by all the codes, but by all the O codes. But if your delivery, if you're trying to determine which one is the delivery code, it often has the word delivery in the code language. All right, coders, that's all I've got for you. Let's go ahead and solve the AMCI way. Number one, inventory. Two, select your first listed code. Three, apply the guideline.
Thank you so much, Mrs. J. Hello, coders. I hope you're doing well and ready for your first scenario. Of the following answers, which best describes the encounter? A. O21.9, B. K52.9, Z33.1, C. O99.89, K52.9, or D. K52.9, O21.9. A 30-year-old patient presents to the emergency department with severe nausea and vomiting. During the evaluation, a pregnancy test comes back positive. The provider documents that the nausea and vomiting are not related to the pregnancy, explicitly stating, gastroenteritis, pregnancy is incidental to this visit. Of the following answers, which best describes the encounter? Okay, coders, you'll have 2.5 minutes to solve, and the time begins now. Good luck.
Thanks, Miss Dolly. Okay, coders, what's your inventory? Okay, here's mine. I said I put ED here just to kind of keep me focused. Whenever you have pregnancies, you got to kind of know where they are. Are they in the ED? Did they move on? Did they go to delivery, etc.? So I just do that for my purpose. So this patient came in ED. The complaint was severe nausea and vomiting. Then, during that encounter, this patient had a pregnancy test that came back positive. However, the doctor says the reason for the encounter is gastroenteritis, and pregnancy is incidental to this visit. In other words, pregnancy is not the reason for the encounter. And when we talk about incidental to the visit, it means that the patient just happens to be pregnant. They're here for this condition and they happen to be pregnant, and it is not a pregnancy related complication. I'm going to let that marinate. Now, I'm going to get rid of some things. Let's go ahead and let's get rid of that ED. We're not coding for an ED. Let's also get rid of severe nausea and vomiting. Yes, it's nausea and vomiting is related to pregnancy as well as gastroenteritis, but we know that the chief reason for the encounter is gastroenteritis because the doctor documented it. The doctor said explicitly that gastroenteritis is the diagnosis and pregnancy is just incidental to this visit. Now, let's see if there's a guideline that could help us quickly solve. All right. So I like guideline C15A1. This guideline, particularly when it says the pregnancy is incidental to the encounter, you're going to sequence this way. First, you're going to sequence your reason for the encounter. Second, your incidental to pregnancy code. And remember, do not use O codes from chapter 15. So when a patient's condition is incidental to another, so their pregnancy is incidental to another condition, you don't use pregnancy complication codes. Oh, by the way, again, O codes are pregnancy complication codes. All right, coders, on site, guess what? We can solve this scenario, right? So if pregnancy is incidental to the encounter, you need that Z33.1, and you do not code an O code. So that means A is wrong, C is wrong, and so too is D. And our answer? Well, it's C. I mean, excuse me, it's B. It's B. All right. Okay, let's do our due diligence and let's look up these codes. 021.9, this is the code for vomiting of pregnancy unspecified. Well, we know that code is incorrect in itself because the doctor said this vomiting is not related to the pregnancy, right? Also, Z33.1, pregnant state incidental pregnancy not otherwise specified. And this is our code because the guideline tells us. In 099.89, this is the code for other specified diseases and conditions complicating pregnancy, childbirth, and the puerperium. This is wrong because this gastroenteritis has nothing to do with the pregnancy and it's not complicated. And finally, K52.9, non-infective gastroenteritis and colitis unspecified. And underneath, I like the gastroenteritis, NOS, and this is our code. So according to this guideline, we need to sequence first our reason for the encounter, which is K52.9, and second, Z33.1, which is your pregnant state incidental. And so B is correct. We're going to eliminate A, C, and D. Encoders, if you said B, way to go, way to go, way to go. All right. We got another scenario. Miss Dolly, please and thank you.
Which code best represents this scenario? A. 024.419, B. P70.0, C. Z37.0, O24.419, or D. P01.9. The newborn's medical record notes that the mother had gestational diabetes, which complicated the pregnancy. The pediatrician determines that this maternal condition may have impacted the newborn and wants to include it in the baby's medical record. Which code best represents this scenario? Okay, 2.5 minutes to solve. Your time will begin now, coders. Good luck.
Okay, coders, what are your key terms? I know this is going to be a little different. This is not your traditional way to document, but I documented the following. Yes, I documented that this is the newborn's record. It's very important that you know who you're coding for because it's very easy to confuse the mother and the infant, right? Yeah. I also wrote that the mother had gestational diabetes. Also, and this diabetes complicated the pregnancy. Also, the pediatrician, I wrote pediatrician, I'm going to show you why in a minute, determines that this maternal condition may have impacted the newborn and wants to include it in the baby's medical record. So that's a lot of stuff. And the only real diagnosis that we have is this gestational diabetes, right? Yeah. So we always have to say, who are you coding for? Is it baby or mom? So coders, who are we coding for? Well, we know this is the newborn record, right? It's not the mother's record. And another thing, the pediatrician is documenting. So if the pediatrician is doing the documentation, you can rest assured that the pediatrician is the doctor for the infant, the newborn, not the mother. All right, so it's really important that you distinguish them. All right, so if we're not coding for the mother, we are coding for the infant. And you know what? We can look at our answers and we could eliminate some things on site. We can eliminate A. Why? Because we see that O code there. O is for obstetrics, right? When we learn to recognize those codes on site, we learn to eliminate A on site. All right, so A's got to go, and so too is C because C is sequencing that obstetrics code second. Got to go. Any part of that answer incorrect, the entire answer is incorrect. So our focus should just be B and D. And now let me go ahead and eliminate what I need. I'm going to get rid of the newborn record. It's just got a nice little, line through it. I'm going to get rid of the mother had gestational diabetes. We're not coding for that. I'm going to get rid of pediatrician, and my focus is here. The mother's gestational diabetes may have impacted the baby. And even though we eliminated A and C, here is the guideline C15A2 that tells us that we need to do this. And this guideline says that Chapter 15 codes are used only on the maternal record. So those O codes are only for the mother. And it reminds you, don't use them on the newborn or infant's record because it's easy to do. Now, let's go ahead and get rid of them. And B and D, all we need to do is look up and see which one is our answer. So if we look at P01.9, this is the code for newborn affected by maternal complication of pregnancy unspecified. Well, I think they were pretty specific that the mother's gestational diabetes may have impacted the baby. Now, if we look at P70 category, transitory disorders of carbohydrate metabolism specific to newborn, oh wow. But if I look at P70.0, this is syndrome of infant of mother with gestational diabetes. So newborn with hypoglycemia, that's in parenthesis, affected by maternal gestational diabetes. Well, I'll tell you one thing. I wish this documentation was a little more specific. However, if I'm to choose either of the two, I'm going to eliminate P01.9 and I'm going to code P70.0 because it says syndrome of infant of mother with gestational diabetes. That is my keyword. And I'm going to say B is the answer. It is the best of the two. And coders, what say you? Let me know in the chat. Okay, so if you got that correct, outstanding. Okay, Miss Dolly, please and thank you.
Of the following, which best describes the encounter? A. O14.93, O60.12x0, Z3A.26. B. O14.03, O60.14x0, Z3A.24. C. 060.13x1, 014.94, Z3A.26, or D, 014.94, 060.10x1, Z3A.26. A pregnant patient is admitted at 24 weeks and 5 days gestation due to preeclampsia. She remains hospitalized for ongoing monitoring and care. The patient delivers the baby at 26 weeks and 2 days gestation. The preeclampsia persisted throughout the entire hospital stay. Of the following, which best describes the encounter? Okay, coders, your 2.5 minutes to solve begins now. Good luck.
Thank you, Miss Dolly. Okay, coders, how did you do with this one? How are you using these keywords? Are you using the keywords to help you drive the answer? I hope so because it really helps me a lot. It does. All right, let's get to it. My keywords. This is a pregnant patient. The pregnant patient was admitted. That's important for the reasons I told you earlier. Number three, this patient is 24 weeks and 5 days gestation, and the patient was admitted due to preeclampsia. Now, this patient remained hospitalized and she delivered the baby at 26 weeks and 2 days gestation. And the documentation says preeclampsia persisted throughout the admission. So, first things first, I'm going to get rid of some key terms. Even though I write down admitted, I just put a little strike through. I can see it. This patient was admitted. Did this patient deliver? That is what is important. And coders, this patient did deliver. All right. I'm also going to get rid of preeclampsia. Why? Because it is, you know, integral to number six. The doctor's mentioning that the preeclampsia persisted throughout the admission, so there's no point in having them both. All right, coders, what is your first listed code? What say you? Well, if you said delivers at 26 weeks and 2 days, outstanding. That's what I'm saying. And one little tip I'm going to tell you, when a patient has multiple conditions, when a pregnant patient has multiple O codes, the O code that's most related to the delivery will be first listed. Okay, now let's go ahead and solve. Okay, so I'm going to break this down into three parts. So the first guideline that I'm going to reference is C15A3, and this is the guideline that tells you how to sequence when you have weeks gestation and basically guidance on weeks gestation. In this first column, you see the breakdown of, the weeks gestation, the trimesters, first, second, and third. And in the third column, it says to code the trimester that matches the patient's current trimester. So when you have multiple trimesters, you're going to have to code only one, and it has to be the trimester that matches the patient's current trimester. All right, so I think this patient is in the second trimester. All right. And also, here's some guidelines down here that says assign the trimester code based on the provider documentation of trimester or week count for the current encounter, whether the condition is pre-existing or pregnancy related. All right, coders. So basically, these two guidelines are saying that you have to code the most current, right? Code the most current week's gestation, and you will come to learn, if you don't already know, that Z3A is your category for week's gestation, and the subcategory portion, the two characters behind the decimal, this actually denotes the number of weeks. So 20 is 20, 21, all the way down to 29. So if we look at our answers, and I'm looking at my weeks gestation codes right here, at a glance, we see that B is coding for 24 weeks gestation, A, C, and D, 26. And our guidance says to code the patient's current trimester, current weeks gestation. Well, if it's in the past, it can't be current. So if she was 24 weeks, then that was in the past because she's 26 weeks now. And you know what? We're going to get rid of B on the strength of it's coding for the wrong weeks gestation. Now, let's move on and let's look more at guideline C15A3. It's got some more guidance. Specifically, when we're talking about when delivery occurs during an admission, use the in childbirth code if available. Otherwise, go ahead and use the code for the current trimester. So, what does that mean? Well, if you look at A, let me get my pointer, A, C, and D, they're all coding for unspecified preeclampsia, right? So if you look at the code 014.9, these codes are arranged according to the trimester. So 04, 014.92, this is unspecified preeclampsia, second trimester. 93 is third trimester, and 94, this is complicating childbirth. 9.5 is the Puerperium, childbirth, right? Our guideline says that when delivery occurs during an admission, use the in childbirth codes. And we did have a delivery at 26 weeks, so we have to use the childbirth code if it's available. And if you look at A, it's coding for third trimester. So we've got to get rid of it. Gotta go. Okay, so this was these two eliminations were used. Well, we followed guideline C15A3. Now we have another guideline that we're going to reference. And this guideline is IC15B4. Coders, you need to keep this guideline handy. You know why? Because this guideline tells you how to sequence when you have a delivery. And if you understand this sequencing order, you're going to you're going to rub your hands and be ready anytime you have a delivery scenario because it needs to be sequenced like this. And it says you're going to sequence first the condition most related to the delivery as principal. And that's why I said delivers at 26 weeks and 2 days is my first listed scenario diagnosis. That's why I said that. Also, it says second, the delivery related complications, right? We have a complication, this preeclampsia. Also, it says then sequence other conditions affecting the pregnancy if applicable. Then fourth, your week's gestation. And fifth, the outcome of delivery code. Coders, this is your sequencing order. Now, I do want to tell you, oh, and also your guidance about sequencing complications after the delivery code, there it is right there. And if you can see where this is going, if you're looking at C and D, all right. So let's get a little more specific. 06, excuse me, 060.1. This is the subcategory code for preterm labor with preterm delivery. Coders, if you see that key term in the code language, often it is a delivery code. And deliveries have to be sequenced first. So, just thought I would tell you that. And so let's go ahead and look at our code. 060.12x1. 060.12x1, preterm labor second trimester with preterm delivery second trimester. Okay, coders. And look at I'm just going to point out the seventh character extenders. They're a little different. So if you have one fetus, one is going to be at the end. If you have two fetus, then two will be there. But you do have the X. The X is going to be your placeholder. And I like this 060.12 because it should be first listed because you've got the delivery in the term. It's most related to the delivery. Okay, now we've got our unspecified preeclampsia, 014.94, unspecified preeclampsia. That will be second. It's your complication. And it says complications go after your delivery code. So if that's the case and we're looking at our answers, C is sequencing the delivery, and then second, the complication, and third, your week's gestation. There is no outcome of delivery, but that's the best of the four answers, and C is correct because it's sequencing the delivery first. And if you said C, outstanding. Okay, coders, if you have questions, go ahead and put them in the chat. I know this was a long one. This was indeed a challenge, but If you learned something, say aha in that chat. I want to know. Let me know. And if you got it right, coders, outstanding. Okay, Miss Dolly, please and thank you. Of the following answers, which best describes the encounter? A. 014.24, Z3A.39, Z37.0. B. 014.24, 014.14, Z3A.39, Z37.0. C. 082, 014.13, 014.23, Z3A.39, Z37.0, and D. 014.13, 082, 014.23, Z3A.39, Z37.0. A Gravida 2 Para 1 G2P1 patient at 39 weeks gestation is admitted with severe preeclampsia. During the hospital stay, the patient develops HELLP syndrome, a serious complication. Due to the worsening condition, an emergency C-section is performed. The delivery outcome is a single live birth. Okay, coders, your time has already started and go. How did you do, coders? How did you do? Did the keywords help you? Well, they kind of guided me. They did. And I guess it never stops helping. All right, my keywords. Gravida 2. So that means this patient had two pregnancies. Para 1, that means one birth. 39 weeks gestation. The patient's admitted with severe preeclampsia. Then the patient develops HELP syndrome. HELP syndrome is the acronym for hemolysis or hemolysis. That's the breakdown of red blood cells, and that can lead to anemia. Also, the EL is elevated liver enzymes, and the LP, this is low platelet count. Now, those elevated liver enzymes are an indicator of liver damage or dysfunction. So it is really serious. And the low platelet, of course, it is an indicator that this patient might be at risk for excessive bleeding. So the doctor said, let's go ahead and perform an emergency C-section. Now, is there anything that we can eliminate? Well, we actually can, but I'm going to leave everything there and we're going to just kind of let this play out. All right, so what is the first listed code? What say you, coders? If you said for HELP syndrome, a complication, outstanding. Or if you said, Mrs. J, you just told us when there's a delivery, the delivery is going to be first listed. That is correct. But coders, this a C-section is not a delivery. Technically, it's not a delivery. Hey, I need you to just kind of work with me. Trust me on this one. Now, let's go ahead and solve. And the guideline we're going to reference is C15-4B. This guideline is when a cesarean section takes place. And as you see, it's labeled cesarean delivery. We're going to change that to C-section because C-section technically is not a delivery. And if you understand that, then you can understand that there are two separate code guidance that you'll need to follow. So when there is a cesarean section, number one, the condition that prompted the cesarean section will be sequenced first, followed by the condition prompting the admission or any secondary conditions or any other O codes. Then your week's gestation, then the outcome of the birth. So in that order. Now, why is it so? We'll talk about that in a moment. Now, let's go ahead and let's look at our codes. We're going to begin with this 082 code. This is the code for encounter for cesarean delivery without indication. That language without indication means there are no complications. So this patient had maybe a scheduled C-section, maybe they had a previous C-section, and they're going to have a second C-section, but there are no complications, no current ones. Also, we have 014.1 and 014.2. But let's focus our attention back on this 082. You do not use 082 when you have a complication. In other words, 082 should not be coded with a pregnancy complication code. Not for this cesarean, right? So let's look at our answers. Look at C. C is coding 082 along with this severe preeclampsia. No, either it's without indication or it is with indication, not both. So we're going to eliminate C. And also D is doing the same thing, but it's sequencing 082 second. It doesn't matter. You cannot code a complication for a C-section with a C-section without indication code. You just can't. It kind of contradicts itself. So C and D have to go, and we're left with A and B. And what is the difference between A and B? Well, A is not sequencing for the severe preeclampsia, and B is. But let's take a look at this severe preeclampsia code. When you look underneath it, there is an excludes one note. And this exclude one says, HELP syndrome. In other words, you are not to use 014.1 if the patient has HELP syndrome. I'm going to let that marinate just for a second. Now let's turn our attention to this 014.2 HELP syndrome. If you look at the supplementary language underneath, it says severe preeclampsia. So HELP is severe preeclampsia with hemolysis or hemolysis, elevated liver enzymes, and low platelet count. So you don't need to code both 014.1 severe preeclampsia along with HELP syndrome. You do not, because it is understood, it is integral. So by virtue of that guidance, B is incorrect because it's coding both HELP and severe preeclampsia. So we're going to get rid of it. And that leaves us with A. Yes, coders, A. And if you said A, way to go. But coders, I'm going to tell you that was a little complex, wasn't it? Yeah, so what did we get from this? Well, it told me that I need to read everything. You're not going to know everything, coders. No, you're not going to know that severe preeclampsia is integral to HELP, but the way we know is reading. So I know this is a time-based exam and you might not have time to read everything, but we are reading now. And I bet that you know that HELP is severe preeclampsia. All right, coders, I know I'm doing a lot of talking and I did not forget. I'm going to show you why or how a delivery and a cesarean are not the same. A delivery, coders. On the left, you see a delivery. On the right, you see a C-section. And remember, a delivery, the mother pretty much is doing all of the physical work. You can see the provider's hands waiting for the baby to be born. Pretty much that is the process of delivery. Now, on the other hand, if you look at C-section, it's more involved. You see a scalpel there in the provider's hand. The provider is getting ready to perform surgery. Yes, this is a surgical procedure. A C-section is a surgical procedure. The physician is going to incise the area where the baby will be born, and it's not just one layer, it's multiple layers. Yes, he has to go through all of that adipose or fat, and the provider even has to move anatomy around to make way for the safe passage of the infant. And in PCS coding, when you are coding for a delivery, and that's a vaginal birth, it's coded to delivery. In fact, in PCS coding, we code for the objective of procedures. So the objective of a vaginal delivery is delivery. However, the objective of a C-section is extraction. They want to extract or remove by force from the body part. Yeah, so this is an extraction. So there are two different processes going on. So I'm going to summarize it for you. But when you have a delivery, those ICD-10-CM delivery codes are pertinent. When you have a C-section, you could either code the 082 when there are no complications, or you have to code that complication that will necessitate or substantiate a C-section. In other words, a delivery is a delivery, and a C-section is a surgical procedure that results in a delivery. So hopefully that makes sense. Let me know, and we're going to move on.
Of the following answers, which best describes the encounter? A. N18.2, O10.22, B. O10.22, C. I12.9, N18.2, or D. O10.22, N18.2. A pregnant patient at 30 weeks gestation presents with chronic hypertension that was present before the pregnancy. The patient also has stage 2 chronic kidney disease, which preceded the pregnancy. Both conditions are being monitored and managed throughout the pregnancy. The provider documents these diagnoses in the patient's medical record. Of the following answers, which best describes the encounter? Okay, coders, you'll have 2.5 minutes. Your time starts now. Good luck.
Hey coders, how are you doing? What were your keywords? Let me get rid of this little light. My keywords. My keywords are pregnant. We have a pregnant patient, 30 weeks gestation. This patient has chronic hypertension. So that means this hypertension existed prior to the pregnancy, and it says it. Also, the patient has stage 2 CKD, which also was prior to pregnancy. And both conditions are being monitored and managed throughout the pregnancy. All right, coders. And notice this patient hasn't delivered yet. So, what is your first listed code? Oh, by the way, I want to put these weeks gestation here. Yeah, not that it's going to change the answer, but let's go ahead and make the code correct. Now, what is the first listed code? If you said pregnant, that could be correct. I think it is, right? Because we have to use an O code, or we should, because this patient has a complication in pregnancy or pregnancy related complication. Now, which guideline will we need to reference? Well, I think guideline C15D is perfect. This guideline is for pre-existing hypertension in pregnancy, and it tells you to sequence in the following way. You're going to sequence first O10 followed by your CKD, and that's it. So coders, let's take a look at our answer. Can you see what is not sequencing that O code first? And you know what? When you're taking your exam, you be sure to do that because you can eliminate them. We can eliminate two answers, A and C, on site. And you know what? That is time saved. Indeed. If you didn't know that, coders, you would be looking up those codes or that guideline. You have just saved yourself about, I'm going to say at least 3 to 5 minutes. All right, now our code. Let's go ahead and let's look up our codes. We have O10.22, I12.9, O10.21 subcategory, and N18, your CKD. Now let's go ahead and get rid of the two answers that was sequencing wrong. We're going to get rid of A and C. But let's go ahead and take a look at what A was coding for. We know N18.2 is your CKD. So it's sequencing wrong. We know that. But look at this O10.22. This is pre-existing hypertension, hypertensive CKD complicating childbirth. Coders, this woman did not give birth. This is doubly wrong, right? Right, so we get rid of it. Also, let's take a look at C. It's sequencing that I12.9 first. This is hypertensive CKD. Now, we know she has hypertensive CKD. However, if it's in pregnancy, you got to use an O code. And if you take a look at the O series or subcategory, O10.21.3, this is pre-existing hypertensive CKD in complicating pregnancy. So I12.9 is integral to this code series. So you don't use I12.9 and the guideline tells you not to use it also. So it's gone. And now we just have B and D. And what is the difference between B and D? Well, B is not coding for the CKD, and D is coding for CKD stage 2. And our guideline says sequence first your O code, your hypertensive in pregnancy code, followed by your CKD. So B is not following the guidance, and B has to be eliminated. And that leaves us with D. Encoders, if you said D, way to go, way to go, way to go. If you had an aha moment, that's even better. That's better. And you know what, coders? Just remember when a patient has hypertension in pregnancy, there are pre existing hypertensive CKD codes if they have hypertension and CKD. Just remember that they exist. You don't have to remember the sequencing order, but you do have to remember that they exist. All right, coders. If you have any questions, I'm in the chat and I'm more than happy to answer. Okay, Miss Dolly, please and thank you.
Of the following answers, which best describes the encounter? A. B20, B59, O98.72, Z3A.28, B. O98.72, B20, B59, Z3A.28, C. Z21, B59, O98.72, Z3A.28, or D. O98.72, Z21, O98.72, Z3A.28. A pregnant patient at 28 weeks gestation is diagnosed with symptomatic HIV disease. She is admitted to the hospital for treatment of pneumocystis pneumonia, a complication of her condition. The provider documents both the HIV disease and the pneumonia in the medical record. Appropriate coding is required to capture both the maternal and infectious conditions. Of the following answers, which best describes the encounter? Okay, coders, your 2.5 minutes to solve will begin now. Good luck.
Okay, coders, what is your inventory? Is it pregnant? Let me get my little 28 weeks gestation, symptomatic HIV disease, and it says that the patient has pneumocystis pneumonia. And that's all I have. If you have more, let me know. Go ahead and type in the chat. All right, coders. So, one thing that I've learned in chapter one, I've learned to differentiate symptomatic HIV from asymptomatic. So, just to remind you, asymptomatic is Z21 and symptomatic is B20. So, have you ever heard anyone say that B20 is symptomatic HIV? No, usually you just hear HIV/AIDS, but really that's what it is. It's symptomatic, it's HIV with symptoms. So, if it's without symptoms, we're going to code Z21. If it's with symptoms, B20. Our case is symptomatic, so we will not be using Z21, and any answer that has Z21 in it is incorrect. So if we look at C and D, both have a Z21, and that is incorrect because the patient is symptomatic. Now, what is our first listed code? Well, we have a pregnant patient with complications, right? Yeah. So there are some complications. That HIV is the complication. So our first listed code is pregnancy. Yeah, because we're going to have to use the pregnancy complication codes. Now, let's go grab the guideline to see how we code a pregnant patient with HIV. Guideline C15F directs us on how to code for a pregnant patient or HIV in pregnancy. And it pretty much says sequence first, 098.7 subcategory, and sequence second, your B20, and third, any HIV related condition. That's it, coders. Now, this is if they have symptoms, that's what you do. When they don't have symptoms, it's right below. You sequence from the 098.7 subcategory, then Z21. And you notice you don't sequence third any HIV related conditions or illnesses, right? Yeah, because if you have HIV related conditions, then it's no longer asymptomatic. All right, let's go ahead and look up our code. Well, we're only going to look up 098.7 human immunodeficiency virus HIV disease complicating pregnancy, childbirth, and the puerperium. And I like these instructional notes. It tells you, hey, that you need to code additionally the type of HIV or that B20, right? Yeah, so it's telling you, just like the guideline, that 098.7 has to go first. And if you look at our answers, B is coding correctly. It's coding first the pregnancy, the HIV disease in pregnancy. Second, your B20. It's sequencing third, the HIV related condition, your pneumocystis pneumonia, and finally, your week's gestation. And A, it's not sequencing the HIV and pregnancy code first. So you know what, coders? There's no point in looking this up. We can just go ahead and eliminate A, and that's our answer, B. Now, if you said B, outstanding. So, coders, how are you feeling? We've got one more. Of the following answers, which best describes the encounter? A. 024.113, Z79.4, Z3A.30. B. 024.113, Z3A.30. C. E11.9, Z79.4, Z3A.30, and D. 024.113, E11.9, Z79.4, Z3A.30. A pregnant patient at 30 weeks gestation presents for a routine prenatal visit. The patient has type 2 diabetes mellitus and has been using insulin since before the pregnancy. The provider documents type 2 diabetes mellitus on insulin well controlled, routine prenatal care. Okay, coders, what say you? We've got this one, coders. We've done this type of coding in chapter 4. I believe it was chapter 4, endocrine diabetes. Yes, we learned how to code for these pregnancy complications. And my keywords: pregnant, 30 weeks gestation, routine prenatal visit, type 2 diabetes mellitus, and on insulin. So the provider says it's well controlled, and this is routine prenatal care. Coders, nothing routine about this because this patient has a pregnancy complication. Therefore, pregnant will be your first listed code. So we're going to use a chapter 15 code. Now, let's go ahead and revisit this guideline. The guideline that we're going to use, C15G. This is the same exact guideline in the endocrine section. So when coding pregnancy and diabetes type 2, here is your guideline. Or not type 2, but just pre-existing diabetes. You're going to sequence first from the 024 category, second, your type 2 or your diabetes code, and third, your insulin, oral hypoglycemics, or non insulin injectable. So, following this sequence, let's look at our answers. Is there anything we can eliminate on site? Indeed, we can eliminate C, because it's sequencing our diabetes type 2 first. It's got to go. And there's no code, no O code in the sequence. Now let's look up our codes. E11.9, we know that this is type 2 because there are two ones, right? Type 2 diabetes mellitus without complications. Now, when we say without complications for this diabetes code, they're referring to diabetic complications, not pregnancy. Now, we've got another code, Z79.4. This is our code for long-term use of insulin. This patient is on insulin, but it is this code series, 024.1. All three codes have 024.1. So 024.113 is pre-existing type 2 diabetes mellitus in pregnancy, third trimester. This is indeed correct. This patient is in her third trimester. But what I'm most interested in are these instructional notes. It tells you to code additionally E11 to identify any manifestations of diabetes. So A and B are not sequencing the diabetes code, right? No E11. And that's the same sequencing order from the MCG. So we're going to get rid of A, B, and our answer? Well, our answer is D. Great job, coders. If you said D, outstanding. But if you learned something, that is priceless. Thanks again, Miss Dolly. Okay, everyone, we have evolved. We are now in chapter 16. This is certain conditions originating in the perinatal period. Code series P for perinatal 00 through P96. Now we're in the perinatal zone. We are switching gears. We're no longer talking about mom, but the baby. That's right. Chapter 16 applies to exclusively to newborns. And we're going to talk about that in a moment. But just know these conditions originate in the perinatal period. What is that? That's the period just before birth through the 28th day after birth. All right? Now, let's go ahead and review some AMCI perinatal coding FTRs and tips. Number one, chapter 16 is only for the newborn, so don't code mom on the infant's chart. Number two, the perinatal period is the period just before birth through 28 days of life. And that's important for you to know because those conditions occur just before birth through the 28 days of life. Yes. Also, use of Z38 for live-born infants should be sequenced first if it's on the initial newborn record. So hopefully we'll give you some examples of that. But that Z38 is a principal listed or first listed diagnosis if on the initial newborn record. Number four, don't confuse Z38 and Z37. I'm almost going to guarantee you maybe 75% of you will have something like that if you're taking the CPC exam that will confuse you. And if you know the difference between the two, then you're going to be able to eliminate some wrong answers really quickly. So Z37 we know is the outcome of delivery, and this is on the mom's record. And number five, use chapter 16 codes for as long as the condition exists. All right, let's get started solving these scenarios. But first, let's review how to solve an ICD-10-CM scenario the AMCI way. Number one, inventory. Two, select your first listed. Three, apply guidelines. And don't forget to trust the guidelines. Now, I present to you Ms. Bianca. Okay, Miss Bianca, take it away.
Thank you, Ms. J. Okay, coders, let's start with our first question for the perinatal period. What is the correct coding sequence for the mother's record? A, P07.16, Z37.0, 080B, 080, Z37.0, C, 080, P07.16, D, P07.16, Z37.0. While completing discharge documentation, the labor and delivery nurse reviews the record of a first time mother who just delivered an 1,800-gram baby girl. The nurse notes the low birth rate and wants to ensure complete documentation by adding the newborn's diagnosis code P07.16 to the mother's delivery record, alongside her other delivery codes. She consults the coding department for guidance. You have 3.5 minutes. All right, let's take a look at our inventory list. So I have discharge, first time mother, 1,800-gram baby girl, low birth rate, and they're wanting to put that on the mother's record. So I'm going to eliminate the discharge here and the first time mother. And I have my updated inventory list up top, and the guideline that I used to help me solve this was Chapter 16A1. And this guideline tells us that if do not use codes from Chapter 16, certain conditions originating the perinatal period on a maternal record. So that kind of tells us what we can eliminate right off the bat. And I have just the little note here as a reminder. But based off of that, we are going to eliminate A, C, and D. And that only leaves us with B, but let's take a quick look at these codes here. We have Z37, which is outcome of a delivery. And this tells us that you use an additional code to identify the outcome of delivery on the mother's record, and it is not for use on the newborn record. And that is exactly what we're coding for here. So remember, this is what they're wanting to put on the mother's delivery record. So this is good for our encounter here. And so we have 080, which is encounter for full term uncomplicated delivery. And this also tells us to use an additional code to indicate the outcome of our delivery. And it tells us the Z37, which we have here. So option B is going to be our answer. And let's move on to the next one. All right, coders, let's jump into question 3. What is the principal diagnosis for Hospital B? A, Z38.00, B, P22.1, C, Z51.89, or D, P22.9? Baby James is born at Community Hospital A with respiratory distress. Due to the facility's limited NICU capabilities, he is transferred to Regional Medical Center B's Level 3 NICU within 2 hours of birth. The coding team at Hospital B debates the appropriate principal diagnosis for the institution's record, considering both the birth status code and the respiratory condition. All right, coders, you have 3.5 minutes. All right, let's take a look at our inventory list. I have respiratory distress, Regional Medical Center B, Level 3 NICU. And the newborn was transferred to this facility within 2 hours of birth. And that's all I'm putting on here because they're asking us what is the principal diagnosis for Hospital B. And so let's move on. Okay, so the guideline that I use to help me solve this scenario is Chapter 16A2. And this guideline says for infants transferred after birth to another facility, the facility the infant is transferred to may not use Z38, which is the delivery code. And so that's going to eliminate option A. And let's take a look at the Z51.89, which is encounter for other specified aftercare, not relevant to our encounter. So we are going to eliminate C. And let's take a look at these P codes. We have the P22 respiratory distress of a newborn. P22.1 is transient tachypnea of a newborn, which is very specific, and all we have listed is respiratory distress. So I eliminated that one and went with P22.9, which is respiratory distress of newborn unspecified. And that leaves us with our option D as our answer. All right, I'm going to move on to question 4. What are the best codes for this encounter? A, P07.03, P07.23, F89, B, R62.50, P07.03, P07.23, C, P07.03, P07.23, R62.50, D, P07.23, P07.03, R62.50. A 5-year-old Michael is brought to a developmental pediatrician for evaluation of learning and coordination difficulties. During the visit, his parents share his birth records showing he was born at 24 weeks gestation, weighing 900 grams. The specialist documents that Michael's current developmental delays are directly related to complications from his extreme prematurity, noting specific cognitive and motor challenges linked to his premature birth. You have 3.5 minutes. All right, let's take a look at our inventory list, and I have evaluation of learning and coordination difficulties, born at 24 weeks gestation, weighing 900 grams, and developmental delays are related to complications from his extreme prematurity. I'm going to eliminate number 1, the evaluation of learning and coordination difficulties. And the guideline I used to help me solve this scenario was actually 2 of them, Chapter 16A4 and E. So A4 states that after the perinatal period, if a condition still exists, use Chapter 16 codes throughout the patient's life. The perinatal period is from 22 completed weeks of gestation to 7 completed days after birth. And this just clarification states that if a condition starts in the perinatal period and persists throughout the patient's life, you continue using that perinatal period code regardless of the patient's age. And E says that when you have low birth rate, weight, and immaturity status, you sequence first the low birth rate, weight, and then second the gestational age. And so based off of this, we are going to eliminate option B because it's not the correct sequencing order. And now let's take a look at P07.03, which we have in A and C here. Well, actually in all of them, which is extremely low birth weight of a newborn, 750 to 999 grams, which we do have the 900 grams birth rate. So we are going to keep this code, and it is sequenced first in A and C, but it's not sequenced first in D. And let's take a look at P07.23, extreme immaturity of newborn gestational age, 24 completed weeks, which we do have. They were born at 24 weeks gestation. We also like this code, so this is the immaturity, which will be sequenced second. And the R62.5 subcategory, other and unspecified lack of expected normal physiological development in child, more specifically the R62.50, which is unspecified lack of expected normal physiological development in a child. We like this code. And lastly, we do have this F89 code that's listed here, so we are going to take a look at that, which is unspecified disorder, a psychological development disorder not otherwise specified. I didn't choose this code because we don't have a disorder listed. They're not saying it's a disorder. So I didn't go with this code. So this leaves us with option C, which is P07.03, which is our birth weight, and then P07.23, which is our immaturity, and R62.50, which is that unexpected lack of normal psychological development in a child. And I will hand you guys all off back to Miss J.
Welcome to Chapter 17. We have moved on from Chapters 15 and 16. Chapter 17, Congenital Malformations, Deformations, and Chromosomal Abnormalities. Q00 through Q99. Now, this is where you code when the condition was present at birth, coders. So that means that that condition occurred in the womb, right? So whether it's a cleft palate, a congenital heart defect, or a chromosomal condition like Down syndrome, right? So pretty much they were born with it and it was developed in the womb. Now let's go ahead and let's review some congenital anomalies, FTRs or TIPS, according to AMCI. Number one, these Chapter 17 codes should stay on the record for life unless it's resolved. Typically, these Chapter 17 codes last for the life of the patient. Typically, even if surgery has taken place to correct it, if it still exists, it must stay. You need to leave these Q codes on the record. And don't confuse Chapter 16 and 17 codes. A lot of people do. Me too, sometimes I do that too. So here is a forensic fact to remember. If the condition is due to the process of being born, go to Chapter 16. If the condition is due to how the baby was formed in the womb, go to Chapter 17. Hopefully that helps. Now, let's go ahead and solve scenarios. Number 1, inventory. 2, select your first listed code. 3, apply guidelines. And 4, it's not 4, but make sure you trust those guidelines, right? Okay, take it away, Mr. Sandeep, please and thank you.
Thank you, Mrs. J and coders. It's time to do a scenario on the congenital anomalies. Here is your first question. Of the following, which best describes the encounter? Option A, Q87.11, option B, Q87.11 E66.9, option C, Q87.11 E66.9 Q53.20, option D, Q87.11 G71.11 E66.9 Q53.20. A 3-month-old infant with diagnosed Prader-Willi syndrome presents with hypotonia, bilateral cryptorchidism, and obesity. The pediatrician documents all findings in the medical record and requests appropriate coding. The geneticist confirms the diagnosis with genetic testing identifying the deletion on chromosome 15. The infant is scheduled for follow-up with the multiple specialists to address various manifestations of the syndrome. Of the following, which best describes the encounter? And your timer is already on. Okay, coders, that is time, and it's time to look into the inventories. So here in our inventory, we are having Prader-Willi syndrome, hypotonia, cryptorchidism, and obesity. And coders, can you tell me which guidelines are we going to use here? Yes, we are going to use the guideline from chapter 17 and states that do not code the manifestations that are inherent to the malformation, deformation, or chromosomal abnormalities. So, when the code assignment specifically identifies a malformation or deformation or chromosomal abnormality, the manifestations that are an inherent component of the anomaly should not be coded separately, and additional codes should be assigned for manifestations that are not in an inherent component. So in our scenario, we have a Prader-Willi syndrome, hypotonia, cryptorchidism, and obesity, right? So do we have to code a hypotonia with a Prader-Willi syndrome? No, because hypotonia is considered an inherent component of Prader-Willi syndrome. So therefore, it cannot be or it should not be coded separately. But obesity and cryptorchidism are variable manifestation that require additional codes to fully capture the patient's condition here. So we can code Prader-Willi syndrome, cryptorchidism, as well as obesity. So option D is coding for cryptorchidism Q87.11, G71.11, and that's a coding for a myotonic muscular dystrophy. So it's not even documented in our scenario. We don't have a patient suffering or diagnosed with myotonic muscular dystrophy. So option D has to go. Option A is only coding for Q87.11, that's a Prader-Willi syndrome alone, so it also have to go. Option B also have to go. So the correct answer would be option C, Q87.11, E66.9, that's for obesity, and Q53.20, which is for a cryptorchidism. Yes, so option C is the correct answer, as most of you have said. So great job, good coding, and now let's look into another scenario. Of the following, which best describes the encounter? Option A, Q23.81, I35.0, Z87.730. Option B, I35.0, Z87.730. Option C, Q23.81, Z87.730. Option D, I35.0, Q23.1, Z87.730. A 45-year-old patient presents to the cardiology for regular follow-up of her bicuspid aortic valve, which was diagnosed at age 15 but never required surgical intervention. During the visit, the cardiologist also notes that the patient had a cleft palate repair at age 2 with no residual issues. The patient's echocardiogram shows mild aortic stenosis related to the congenital bicuspid valve. The patient is scheduled for annual follow-up to monitor the progression of aortic stenosis. Of the following, which best describes the encounter? Encoders, you know the protocol. Your time has already begun, and you can place your answers in the chat. And that is time. So let's have a look into the inventories. You all did a great job. Great answers already in the chat. So in the inventory we have bicuspid aortic valve, a cleft repair performed at age 2, and mild aortic stenosis. And once again, we are going to use the guideline from chapter 17, which says that chapter 17 codes may be used throughout the life of the patient, and you have to use a personal history code if the condition has been corrected and is no longer being treated. So I can see from the documentation that we had a cleft palate repair done at the age of 2 with no residual issues. So the ICD code Z 87.730 is coding for a personal history of corrected cleft lip and palate. So that's a good code selection. And also the code Q23.1 is coding for a congenital insufficiency of aortic valve. And below the code you can see under strike for bicuspid aortic valve, which means that bicuspid aortic valve is no longer coded under Q23.1, and we do have another code in Q23.81 that codes for a bicuspid aortic valve. Yes, exactly. And you can also see the instructional notes which states that code also, if applicable, acquired aortic valve disorders such as aortic valve stenosis with the code I35.0. And in documentation it was said that patient is now showing mild aortic stenosis, right? So we can also code for a mild aortic stenosis, and the code would be I35.0. That's coding for a non-rheumatic aortic valve stenosis. So already I can see option D is incorrect. That's coding for Q23.1, and Q23.1 is coding for a congenital insufficiency of aortic valve, and bicuspid aortic valve are no longer coded with Q23.1. And option C is incorrect. That's coding for Q23.81 Z 87.730, but it is not coding for aortic valve stenosis. Option B is incorrect because it's not coding for Q23.81. That would be by bicuspid aortic valve. And the correct answer would be option A, that is going to be Q23.81, which is for a bicuspid aortic valve, I35.0, which is for aortic valve stenosis, aortic valve stenosis, and Z87.730, which is for a personal history of corrected cleft lip and palate. And your correct answer, as most of you have said, is option A. And it is time for me to hand it over back to Mrs. J. Ms. J, please. And thank you.
Thank you so much, Mr. Sandeep. This sums up our instruction. I want to remind you to continue to self study chapters 15 and 17 guidelines. If you have the MCG, this is gold. Also, if you're in Discord, go to Discord for additional resources. All right. Now, just want to review the homework really quickly. All right. So, if you are new, you can go to www.amcicoding.com. This is our website. And at the top of the website, click on YouTube course. After clicking on YouTube course, read everything, scroll down until you come to the 16-week YouTube course syllabus. And you don't have to go there. We do have it in the chat. Team, the link is in this corresponding slide. All right. So go below the slide and you can find the link. Thank you so much. Please put it in the chat. And also, you'll see the required textbooks. Then, for week 7, this is what you'll need to do. Number 1, download the class PowerPoint playback handout. If you are in Discord, it is there. It's under resources file or the handouts. Number 2, you can watch this playback. If there's something that you need to revisit, you can do so here at number 2. Click that green link. Number 3, if you don't have the MCG manual, read the official guidelines here. Click that blue hyperlink. Number 4, it's a reminder to read the guidelines. I've already asked you to, so I know you will do it. Number 5, go ahead and do your reading assignments. Carol Buck's Unit 2, Chapter 7, Pregnancy, Perinatal, and Congenital Conditions. Number 6, we have some additional lectures for you to watch. Go ahead and click that green hyperlink link. Number 7, don't forget about the AMCI MCG TAP lectures. This is where we show you how to tap your MCG manuals. If you have the 2025 edition, click on the second, go to your table of contents and click on the second step. You'll see charts, video, exam, and additional resources. Also, these are the last 2 CHAP lectures. Yes. There's only 15 and 16. No more after that. And on purpose, coders, we want you to be, we want you to be able to do it yourself. And I know you can do the next chapters yourself. I just do. All right. Number 8, if you want additional practice questions, you can find them in Discord. Yes, so you can find them under resources. And do not hand these in. There's no need. But if you have questions, just go under your ICD-10-CM questions and click pregnancy, perinatal, and congenital. So the coding subjects, ICD-10-CM, go ahead and click on that and ask your question. All right, so hopefully that helps. Again, the syllabus is where you'll find these. And again, team, please put the link for the syllabus in the chat. And coders, you did it. You completed week 7. You mastered 3 chapters of guidelines: pregnancy, perinatal, congenital. You did it. I don't know if you mastered it, but you're on your way to mastery. Okay? So we've got one final week of ICD-10-CM ahead. So stay the course. Don't give up, coders. Don't. You've got this. You can do it. And then we're on to CPT. We're closer to certification. So I want to just thank you for everything, for being a great student, for showing up every week. But we need your help. We need you to complete the survey. It helps us help you. We do implement your suggestions and questions. So let us know. And coders, please put, not coders, team, please put the link for the survey in the chat. Now, one more thing. If you've enjoyed this class, please take a second to give it a thumb up. Yes, like it up. There it is. That's where you can do it. And if you didn't like it down. Like it down. Okay, thumbs down. All right, coders, your support means the world, and one click goes a long way. Thank you. And finally, as we close out class, I cannot not thank the AMCI team. You are worthy of honor because it's you who pours your expertise, your heart, and dedication into every single lesson. So thank you to my team for your passion. You are the reason AMCI continues to raise this bar. Okay, coders and okay team. I always call them coders, but they know who I'm talking about. You are the best and you are among the brightest. And coders, you coder. Remember, medical coding is more than a skill. It's a craft, it's a career. So we don't want to rush this process, do we? No. So thank you for taking the time to study the way you should because you are committed to excellence. You are doing your part for this profession, right? So we're not exam prepping here, no. No, we're creating medical coding masters and we're creating coders that are going to excel at the highest levels if you want to. So go study, go practice, go be great because you are. And we'll see you in the next session, coders. Until next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all